DW Africa Link.
The death of 21-month-old Nkanu Nnamdi, son of renowned Nigerian author Chimamanda Adichie, has reignited calls to overhaul Nigeria's healthcare system. The family alleges medical negligence at a private hospital on January 7th. Nigeria's health minister has now admitted to systemic challenges and announced a national task force on patient safety. But Nigerians are asking, does it take the death of a celebrity's child to trigger reform?
Our health matters, right? So yeah.
In my own opinion, Nigeria healthcare center are actually good. They actually try their best. They're actually doing what they can do.
Well, the healthcare sector in Nigeria, there's a structure, but it's not really working as effective as it should.
Stay tuned for this and more coming up shortly. I am Adwoa Tenkoramaa Domena, and welcome to Africa Link, the podcast that connects you to the stories that matter.
Africa Link, every weekday here on DW.
The family of Chimamanda has accused the private hospital where their baby died of gross medical negligence, alleging the toddler was given an overdose of the sedative propofol during preparation for an MRI scan. This incident, one of many, has sparked a series of harrowing experiences Nigerians have shared on social media about their healthcare system. Now, following this public outcry, the country's health minister has admitted systemic challenges and announced the creation of a national task force on clinical governance and patient safety to improve the quality of care and patient safety. So, did it have to take death to bring reforms to a broken system? Joining me to unpack this are Dr Agbor Ebuta. He is a consultant family physician and the Vice President at Medical Initiative for Africa. We also have DW correspondent in Lagos, Nigeria, Olisa Chukwumah. Welcome, gentlemen, to the show. Dr. Ebuta, I would like to begin with you. What would you say is your honest assessment of Nigeria's healthcare system as we have it now?
So the Nigerian healthcare system, I would say, if you look at it historically, especially in the last couple of years, seems to be on the rise. It's on a journey and it's not where it's supposed to be yet.
We're having this discussion on the back of an incident that has triggered a lot of public reaction. I'm talking about the death of the 21-month-old son of Chimamanda Adichie. When the stories were posted, we have seen a lot of social media reactions. Whether these are true or not, we cannot verify. But for instance, let me just pick out one of the comments I have seen on Twitter. One person said, Nigeria can happen to anyone, regardless of financial or social status. There's another person that says, Nigeria is a scary place to have a medical emergency. It looks like the public opinion on healthcare and access and delivery in Nigeria is not very appetizing. What do you say about that?
Well, in all sincerity, yes. The healthcare system in Nigeria is challenged. Nigeria is not a first world country. All the sectors in Nigeria are challenged. We have all kinds of challenges. So our standards are not as high as what you expect in the West, like in the US, in Europe. These are very advanced economy. Their budgeting percentages are very high. So their standards are very high. So our standards are not as high. Yes, we are aspiring to get there, but our standards are not as high. But we also must understand that this particular incident did not happen in a primary healthcare center, far away from civilization, far away from the urban. It happened at the epicenter. It happened at the Uracare, if I'm allowed to mention, because these are not all the centers that have been mentioned in connection with this unfortunate incident are not just primary healthcare or low-level centers that the regular Nigerian assesses. These are world-class centers that have standard accreditation from international organizations. And of course, they may have recorded a lot of successes, but in this particular occasion, they failed And also, no, not I won't say they failed, but I would say that this situation happened and it's being investigated to find out what really happened. There's a lot out there. But again, it is important to point out that this was not the average Nigerian hospital. This was the best of the best. And I'm sure they may have recorded a lot of other successes that did not make their way to the public space, mainly because there were no challenges.
Doc, is this not the more reason why people should be worried? Because if the best of the best, something of this sort is happening, then what do you say about the person who does not have access to the best of the best? What is the situation in the public facilities?
Okay, so it definitely is worrying. But I'm not going to try to trivialize what has happened or to undermine it. But we must understand that in every sector there are risks. Even in the aviation sector across the world, you have percentages of plane crashes. Even if plane crashes are the safest means to travel, you still have plane crashes. In some countries of the world, you still have road traffic accidents, despite all of these things. This incident is not the only reflection of what the situation is. Yes, it highlights challenges in the system, but it does not represent the daily occurrence in every facility, in every consultation. So doctors in Nigeria still attend to people, still save lives, you get. So this particular incident is not going to be like the standard. It's not like every doctor you see in Nigeria is going to be very negligent, is not going to do what is right and all of that. You get doctors in Nigeria are really doing their best. Burnt out rates are high. Doctor-patient ratio in Nigeria is 1 to 10,000. So you cannot expect things to be very, very rosy. Doctors are under a lot of pressure. A lot of people do not have access to doctors established because of the doctor-patient ratio. Even if you look at comparatively, we have a doctor gap of 350,000 doctors. But in the UK, the doctor gap there is just 50,000. In the US, it's just about 60,000. In Canada, it's just about, 50,000. So every economy, even in Western economies, they do have doctor patient ratio gaps that needs to be filled up. It's just that it's much, much wider in Nigeria. And while we recognize this challenge, we want to also say that this is not what happens in every consultation that a patient sees. It's just that, yes, due to the poor patient-doctor ratios we have, the chances may be maybe higher.
Thank you for that, Doc. But Olisa, let me come to you. What is the level of trust among Nigerians in their health sector?
Well, that's an interesting question and also very layered and broad if you ask the average Nigerian in terms of trust. Because trust, they say, comes with a lot of baggage in there. The average Nigerian, being a reporter on ground, reporting so many stories, including health stories, the average Nigerian wants good health care. So it goes beyond a matter of trust. The average Nigerian knows that, when they go to the hospital, the doctors are there to help them, not to neglect them. They know that. But the average Nigerian knows that the medical sector is deeply challenged. Many will tell you the issue about, absence of governance down the years, even during this military regimes, even the early parts of democracy era that we're still on, that, primary healthcare centers, not even the big hospitals, how well funded and well stacked that is in primary healthcare centers. The average Nigerian knows that sometimes going to a private hospital, whether it's the mid-level or the high level, is what they can afford. So it's not even a level of trust, it's a level of this is what they have to do to stay alive. Because if they don't go to the hospital to try and get some level of treatment, the worst will always be the case. So for the average Nigerian, they just want their medical sector to function. And this issue with the latest case now with the death, sad story about Chimamanda's son who died, unfortunately, where the family accused the hospital in question of medical negligence. it's caused a lot of social media debate because Nigerians say it's not just about people like Chimamanda, people about on the streets, because they know that generally, if the standards for the basic healthcare is not there, why won't even the highest expensive hospitals be challenged? Yes, they expect these challenges to be there until we have standards across the board. Then you can expect some level of safety and trust. Nigerians joke a lot about this, like the comment you said, when Nigeria happens to you. It's largely driven from a healthcare, scenario where they say if you think you are rich in Nigeria, just have a medical crisis, then you know how poor you can be, because it's to get proper healthcare is expensive, and that doesn't even come with guarantees because there will always be challenges. So for the average Nigerian, it's beyond an issue of trust. I think it's a case of where they know that whether they are paying out of pocket or whether the government is heavily going to fund healthcare and there will be, all-round care, they want to get that. The average Nigerian knows that doctors are leaving in droves. Even the average Nigerian parent who has a child who is a doctor will encourage their child to also do what they call JAPA. And just like our doctor here pointed out, the patient-to-doctor ratio is staggering. That's one doctor to over 8,000 patients. The health system cannot cope with that.
Thank you, Olisa. Doc, I would like to return to you now. One is on the issue about the health minister admitting to these challenges. And Olisa has given us a very nuanced, picture of what the ordinary person feels like when it's time to go to the hospital. What do you think really triggered the health minister to admit that indeed there are systemic challenges and even go ahead to announce this task force?
Well, I think the health minister came prepared for his job. He realized the job he came to do, and he set about it right from the onset, looking at the various sectors. So just pronouncing it at this point, I think is mainly symbolic to a large extent, given the background context, and was also to use this current framework to strengthen all the existing efforts. So I think it's a welcome development. The government had been trying to do quite a few things, but with this incident, I think they already wanted to now come up with an additional task force, because let's not forget that there are already internal measures. There are structures to address any situation in the health sector that appears to be the outcome of negligence or poor standards. Because, for example, if you have the kind of scenario that has happened now, which is is a daily occurrence everywhere. We have litigation in every health sector in the world. So the Medical and Dental Council. So when there are issues like this, for example, a hospital typically can set up what you call a disciplinary committee to look into the matter. Apart from that, the Medical and Dental Council of Nigeria has what you call the disciplinary tribunal, which has the status of a high court and has the responsibility of investigating any suspected situation of medical negligence or related occurrences like that. The third thing the third framework that exists to address this situation is what you call civil litigation. Patients are allowed to sue hospitals and doctors for damages and compensations where the situation arises. And there have been several of those kind of occurrences. The last thing, obviously, is the coroner's inquest. These are standards, because if a patient walks into your hospital and he dies within 24 hours, that is automatically a coroner's case. So you already have checks and balances and governance issues to address any situation that is suspected to be a health negligence. So what the minister did was just to set up an additional framework to support what was already existing. But then and again, we have this kind of situation happening. It may not make its way to the media, but I think it's something for us to build on, to find ways of strengthening the system, government, private sector, civil society. And of course, it's wonderful that DW is having this discussion to deepen the engagement.
Doc, thank you so much for that. Now, I would want us to tackle some of the issues you have mentioned. We have the strike by medical officials, and sometimes it go, as much as 50-day strike. There's also the JAPA phenomenon. Where do you think really Nigeria can begin tackling the issues in its public health system or in its health system in general?
Okay, with respect to the strike issues, one of the common problems or the common reasons why people have gone on strike has to do with remunerations. Remunerations for the various sectors within the healthcare system and comparative remunerations for the various sectors. So that said, sometimes the doctors, the non-doctors in the healthcare sectors agitate for parity. That means they want a salary that is almost same as a doctor. Status, parity, and recognitions. While the doctors most times insist that no, this is not international standard. So it has happened so often that people now go for strike for that and a couple of other reasons. So what has now recently happened, which never used to happen before, is what you call the collective bargaining, where every actor in the healthcare sector is on the same table to negotiate an outcome that is acceptable to all, so that people don't go and strike because of what you've accepted and negotiated with one person and you are now trying to implement. So to a large extent, a key factor for why strikes happen is being addressed. The other factors are issues of maybe agitation for status within the civil service, for recognition by specialist bodies, for payment of some specialist allowance. And these are agitations that are likely to continue because government financing is subject to, government financing is not inexhaustive to a large extent. That's why you have budgeting. So it's a major, major challenge. But what I believe is that engagement is critical. With respect to JAPA is a phenomenon that is not likely to go away, because if you look at it, if Nigerian doctors are among the best in the world, they are highly sought after, and the education level in the medical schools in Nigeria is actually top of the range. So you see Nigerian doctors passing these international exams with ease, and you see that when they find themselves in shores abroad, they perform quite well. So those organizations abroad are very willing to shop for Nigerian doctors. But more importantly, at the crux of this matter is the fact that due to foreign exchange change, most African currencies are highly devalued. So the exchange rate is in favor of the dollar and the pound sterling. So once you cross over to other economies, you tend to earn maybe 10 times what you would earn. So if you are earning 10 or 12 times what you will earn in your home country, it means that in 1 year, you are going to earn what you would have earned. If you travel abroad in 1 month, you would earn your 1 year salary in your home country. There is a phenomenon, or there's a concept called parity in terms of purchasing parity, purchasing power, where you look at the local economies and what your purchasing power is based on your salary. But when you look at savings, if you save 10% of your salary in an African country and you save 10% of your salary in a Western country, you now repatriate those funds to Africa, that savings tend to have more impact. So these are so I would sincerely say that at the center of why people migrate has a lot to do with the pay. Other issues, obviously, with some has to do with security. So in some security hotspots, health workers have chosen to migrate instead because of they feel their families will be safer.
Let me ask my last two questions, one for Olisa and then one for you, Doc. Olisa, your question is that when you look at the public facilities, health facilities across Nigeria, or even where you are in Lagos, what is the state now? And what will it take to restore the trust that Nigerians have You say that it's not necessarily an issue about trust, but that may be a starting point for a lot of people.
Well, for one thing, Nigerians would like to see, funding in the healthcare sector, the public healthcare sector, which takes care of even primary, healthcare centers down the streets and even in rural areas. Where that's the thing, because we have rural underfunded and urban still struggling underfunded. So that clearly is eroding all that trust. So I think for the average Nigerian who we speak to every day when we go to primary healthcare centers, they want to see that when they go, even when when there's not an emergency, because emergency issues now is like, oh, when Nigeria then happens to an emergency. Minus emergency, people want to see that their hospitals are well funded, their doctors are well taken care of, that they don't have to worry, and their nurses too are well taken care of. JAPA affects not just doctors, but also nurses. People want to see funding that when they go to the hospital, they will get good diagnosis. The doctors are not pressured. They don't have to pay for. There's this thing that always happens in Nigerian hospitals. Down the years, you have to pay for syringe, or sometimes you pay for gloves, or they tell you sometimes you have to buy your own cotton wool. Some little things that really make the hospitals, whether private or public, look like a joke, because these are medical facilities needed for the medical staff to do their job. And when these things are not there, that sometimes family members have to run to the chemist to go and buy it and come back to the hospital. During emergency situations, it makes people look at the whole thing as, Nigeria has happened to this one.
Thank you very much. Olisa Chukwumah is DW correspondent in Lagos, Nigeria. Doc, you have the final words.
The trust would build or would increase when Nigerians see more funding. The trust would increase when Nigerians see more transparency. But we need to build on what is happening now. In the last 2 years, the Nigerian government has added 4 million people at least into the national health insurance. The rate at which the numbers are being added has to go up, because out-of-pocket expenditure is 70% of the Nigerian, affects 70% of the Nigerian population. So we want to see a situation where more Nigerians are taken up under the cover of the national health insurance. And the efforts have been outstanding. It has never had added as much as 4 million per year. So we want to see as much as 40 million people added minimum in the next 10 years. But that number should go faster because the Nigerian population is large. The other thing is that the Basic Healthcare Provision Fund, which is a special insurance fund that goes directly to primary healthcare. For the first time, we are seeing that money is going to primary healthcare. Now, what also needs to happen is that money should be followed until it achieves what it's supposed to achieve, meaning that organizations like the ICPC, the Independent Corrupt Practices Agency, has to be on their toes. Other oversight organizations have to make sure that this money that are being disbursed actually are used for the Nigerian population.
Very well. Thank you so much for speaking with us. You just heard Dr. Agbor Ebuta. He is a consultant family physician and the vice president at Medical Initiative for Africa. Earlier, you also heard DW correspondent in Lagos, Nigeria, Olisa Chukwumah. Thank you both for your time.
Thank you. I appreciate it.
Thank you.
What is the public perception among Nigerians about the healthcare sector? Some of them share their thoughts with us.
At the moment, I don't trust Nigerian healthcare sector because over time, we don't have a choice at the moment. If any one of us had a choice, would leave the country and go somewhere else to find a good healthcare. They are not giving out the best.
It's terrible. It's very poor. They have to look into it and just like make all this, improvements that matter. Because our health matters, right? So yeah.
In my own opinion, Nigeria healthcare center are actually good. They actually try their best. They are actually doing what they can do to help our health, particularly. But to my own advice to civilians, for general everybody, you are the governor of your health. You should know how.
Well, the healthcare sector in Nigeria, there's a structure, but it's not really working as effective as it should. We have good doctors, but at the same time, there's a lot of negligence, honestly. The government-owned hospitals and even the private hospitals they are kind of negligent with the way they treat their patients.
Now, while grief should not be the trigger for reform, history shows it often is. Will Nigeria's health sector truly be revamped to benefit the people? Time will tell. Share your thoughts on this topic with us on Facebook at DW Africa. Listen on Spotify or wherever you get your podcast, and subscribe to our DW Africa YouTube channel so you never miss an episode. This show was co-produced and edited by Isaac Mugabe. I am Adwoa Tenkoramaa Domena. Many thanks for listening.
DW, made for mind.